Welcome to Thursday's edition of COVID-19. Korea's daily tally has hit an all-time high today, and we have more on this before delving into the phenomenon of breakthrough infections later on in the program. We start now with the pandemic updates with our Kwon-soa. Now, Soa, let's begin with this grave milestone here in the local front.
Sunny, that is a milestone we would have liked to avoid before most of the nation's population is vaccinated, but it did happen. Korea has recorded its highest daily caseload since the pandemic broke out around 1.5 years ago, and that on the back of a rising trend in the metropolitan region, also amidst more activities among the younger people. So 1,275 is the figure we're seeing as of 12 a.m. And that's also 35 more cases than the last record in late December, which was during the peak of the third wave here in Korea. And with that, the number of domestic transmissions has also reached an all-time high at 1,227. So the country now has more than 164 infections in total. And as we see on the graph, for the second straight day, we have more than 1,200 cases, also a rise by over 60 cases compared to yesterday. And also, according to the higher numbers now, we have more than 10,000 people that are currently quarantined due to the virus. And again, we are seeing the highest numbers in the capital region, especially here in the capital, Seoul. Now, there are discussions whether the social distancing measures has to be raised to the next level, especially in the capital, Seoul, which may meet the criteria for the highest level 4 of the revised social distancing system by tomorrow. So that is another concern.
Right. And so the resurgence, I understand, is raising concerns within the academic arena, which is why relevant authorities earlier on this Thursday morning held a briefing to address them.
Right, Sunny. There are especially concerns due to the plan of the government to get all students back to in-person classes in the second semester, and the concern because of the rising figures here. But the ministry did say that there will be no change to that plan as of now, and it will handle the return to school according to the level of social distancing measures. Now, the immediate plan is to smoothly proceed with vaccinating all people that are related to the education field. And as earlier announced, the government has moved up its vaccination plan for teachers of first and second graders at elementary schools and instructors at kindergartens by 2 weeks, so scheduled to kick off on July 13th. High school seniors and others taking the college entrance exam this year, as well as related staff, will get their shots beginning on the 19th. And additionally, some 210,000 faculty of private institutions in the capital Seoul and Gyeonggi-do province will also be subject to vaccination between the 13th and 24th this month. And speaking of vaccination, yesterday we have a little less than 100,000 people who have been inoculated for COVID-19. Now, meanwhile, over at the World Health Organization, officials are urging countries to be extremely careful with reopening despite higher figures of vaccination, and especially as the coronavirus keeps evolving. Here's more.
The world is at perilous point in this pandemic. We have just passed the tragic milestone of 4 million recorded COVID-19 deaths, which likely underestimates the overall toll. Some countries with high vaccination coverage are now planning to roll out booster shots in the coming months and are dropping public health social measures and relaxing as though the pandemic is already over.
And here is the figure of deaths that the WHO chief just mentioned. And also with over 462,000 new infections, that includes the UK with over 30,000 infections in the past day. That's the highest since January, while Indonesia has hit a record high in daily infections as well as deaths in the past day. And those are the figures I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, now the alarming rebound in daily cases here in the metropolitan region is threatening the country's containment strategy and its hopes to restore a sense of public normality in the near future. For more on this, I have our Lee Kyung-eun here in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right, then Kyung-eun, let's begin with the COVID-19 infections here in this region.
Well, Sunny, authorities say the situation is very urgent. Over 80% of the new infections are being reported from Seoul and the surrounding Gyeonggi-do province. The virus is spreading quickly, especially among young people, those in their 20s and 30s who have yet to be vaccinated. This is why areas that many young people visit have emerged as COVID-19 hotspots. Gangnam-gu, Junggu, and Yongsan-gu districts were the three hardest hit areas. More specifically, sporadic cluster infections are popping up in places like restaurants, cafes, pubs, and schools where many young people spend their time. This is unlike the third wave when infections were mostly occurred in large clusters at places like nursing hospitals and care centers. This is what authorities had to say on the unfolding crisis.
수도권 확진자 증가에 따라서
We believe the rising number of infections in the capital region may be signaling the start of a fourth wave.
Authorities say the current trend is likely to persist until early August, but what could make the situation even worse is the Delta variant. Authorities say the number of new cases of the Delta variant in the capital region has reached an alarming level. Experts say the Delta variant must be contained at all costs before it can trigger a super spreading event, leading to an exponential surge in cases.
Right, and that is precisely why authorities are delaying the planned ease in social restrictions for the greater Seoul area, right, Kyung?
That's right. The government has decided to extend the level 2 distancing measures for the capital region for another week. That means private gatherings of more than 4 people will still be banned, and restaurants and cafes will have to close by 10 p.m. There was speculation that the government will enforce level 3 measures under the new 4-tier system that the country is transitioning to. Although the new level 3 rules come with greater restrictions on private gatherings, they will also allow nightlife venues to reopen and gyms to open until late hours. The government said as of now, adopting such measures will only create more ambiguity in how the public might interpret those rules.
There was confusion among the public on whether the transition to our new social distancing framework constituted a strengthening or easing of measures.
The government has also decided to ramp up testing in the capital region. First, it will recommend at least one person in each household to get tested. An extra test center will also open in each district for a total of 51 locations in the city compared to the current 26. Also, preemptive screenings will be carried out at high-risk facilities like pubs and indoor gyms. In the meantime, all public transit would operate at 20% reduced capacity after 10 p.m. The government said it is considering even tighter restrictions if these measures don't have the desired effect.
If the current outbreak isn't brought under control, we may need to take measures that fall under the highest level of our new social distancing guidelines.
Under level 4 of the new distancing guidelines, gatherings of 3 or more will be banned after 6 p.m., and more venues will be added to the list of places that must close at 10 p.m. Whether that would actually happen or not will largely depend on whether the outbreak could be tamed in the coming days ahead.
I see, Kyung-won. Meanwhile, Kyung-won, what is being done to ensure that businesses are abiding by all prevention efforts?
Well, the government is ramping up inspections on businesses to make sure they comply with all guidelines. It will team up with local officials and law enforcement to dispatch some 100 special inspection teams, and they will inspect random venues unannounced to determine if any infractions have taken place. Also, starting Thursday, one-strike rule takes effect. Any violators will face an immediate 10-day business shutdown instead of the usual warning for first-time offenders. If frequent violations are reported in a particular industry, the entire business sector could be subject to greater restrictions. For example, in the city of Daegu, all singing rooms had to shut down for a week due to the poor record-keeping of visitors of some owners there. Some of these decisions will be made by local authorities. That's part of the central government's efforts to shift towards greater regional autonomy in containment efforts.
I see. All right, Kyung-won, as always, thank you very much for the coverage.
Thank you for having me.
Right, it's time now for the afternoon briefing on the local COVID-19 situation for this Thursday. Now, at present, the Greater Seoul area is looking at tighter restrictions amid the recent rebound in daily infections. Up on the screen are the current COVID-19 guidelines for both the metropolitan region and other regions across the nation. Now, the outdoor mask mandate for those who have received at least one dose of the COVID-19 vaccine has been reimposed in Seoul and its surrounding area. But for those outside of this area, the outdoor mask mandate has been lifted. The outdoor consumption of alcohol has been banned after 10 in the evening here in the Greater Seoul area, while there is no such restriction elsewhere nationwide. Social restrictions at the former level 2 alert is the case for the capital region, but again, outside of this area, the new level 1 guidelines are in place, with of course a few exceptions, including the southern port city of Busan. With regard to social gatherings, the metropolitan region faces a cap of 4 people, while in most other regions the cap stands at 8. Indoor dining and drinking at restaurants and cafes is allowed until 10 at night here in the Greater Seoul area, with only delivery services permitted afterwards, but no restrictions are in place elsewhere. Meanwhile, the future direction of COVID-19 prevention measures for the Seoul area will depend on the trend of the current outbreak. Now, we are still waiting for the briefing to start, so let's take a broader look at the revised framework of social distancing guidelines, which were initially supposed to go into effect nationwide this month. The new framework includes a 4-tier arrangement. Level 1 refers to scattered daily infections, meaning fewer than 500 daily cases across the nation that are within medical capacity. Accordingly, the response involves individual compliance with simple and basic efforts to curb transmission. Level 2 refers to cluster infections within the community, standing at over 500 daily infections, but fewer than 1,000 nationwide, and the response involves limits on the number of people at both indoor and outdoor venues. Level 3 refers to larger regional infections that would be more than 1,000 but fewer than 4,000 on a daily basis nationwide, and the response involves a ban on all gatherings for social purposes. Finally, Level 4 refers to a nationwide outbreak of over 4,000 daily cases, and the response involves the imposing of a stay-at-home order. Now, for the specifics with regard to gatherings, Level 1, under Level 1 that is, there are no limits on the number of people meeting for social purposes, while events with 500 or more people simply require prior registration with local authorities, and rallies can host up to 499 participants. Under Level 2, social gatherings of up to 8 people are allowed, while events such as weddings and rallies can host a total of 99 people. Under Level 3, social gatherings can only involve up to 4 people, while events face a 49-person people cap, as do rallies. Under Level 4, only 2 people can gather outdoors if a stay-at-home order has yet to be fully imposed, while all events are banned and only 1-person protests permitted. Moving on to guidelines at places of work and worship, under Level 1, workplaces, regardless of their size, are encouraged to adopt a working arrangement that allows workers a blend of online and offline options, while places of worship can host 50% of their capacity. Under Level 2, workplaces with 300 and more workers will be asked to have 10% of their workforce working from home. Now, the exception is the manufacturing industry, while places of worship can host 30% of their capacity. Under Level 3, workplaces with 50 and more workers will be asked to have 20% of their workforce working from home. Again, the exception is the manufacturing industry, while places of worship can host 20% of their capacity. Under Level 4, workplaces will be asked to have 30% of their workforce working from home, regardless of their size. The manufacturing industry will be an exception, and places of worship will only be able to host virtual sermons. Meanwhile, at multi-use venues under Level 1, basic prevention measures are encouraged with no restrictions on business hours. Under Level 2, venues will be asked to limit their patrons to 50% of their seating capacity. Also, restaurants, cafes and entertainment facilities will close doors at midnight. The briefing is about to start. We'll come back to you afterwards.
브리핑 설명이 있겠습니다.
Let us now begin our regular briefing for July 8th.
During the past week, we have seen a surge in the number of infections, and this has been a 53% rise. And we see that this current moment, we are at the entrance of a new fourth wave of infections. In particular, we are seeing cluster infections in the metropolitan area, and we are seeing the second straight day with over 1,200 cases. However, compared to the third wave, where it was before we rolled out our vaccines, our fatality rate has dropped by 1/3. Nevertheless, we are also seeing more detectance of the Delta variant, and we cannot rule out the possibility of the Delta strain becoming a dominant one sometime later in August. And in also South Korea, we have seen the Delta variant capacity rising from 30 to 39%, and in the metropolitan area, this has also rose significantly from 28.5% to 39%. And as for the identification of the Delta variant, we are seeing a threefold increase, and also we are seeing a significant increase in the metropolitan area as well, from 4.5 to about 12%. And to this end, we are cooperating with the private sector. We are also modeling our analysis, and we have also our further predictions for the future. And as of late July, if the current daily infections continue to be sustained, we believe that we will see a daily tally of 1,400. However, if things worsen, we could also expect to see about 2,000 daily cases in the future. However, if we are able to contain the virus effectively, our daily tally would also be on a rise. And if we are able to continue to roll out our vaccines as scheduled, we believe that by September, our daily tally is expected to decline significantly downwards. And to this end, the current government, the quarantine officials currently, we see that we need to cooperate fully with the medical sector together with the private sector as well, and also the rest of the public. First of all, the government will also intensify our preemptive testing, regular testings for high-risk facilities. We will mobilize more people and also enhance the number of epidemiological investigators. Moreover, we will also set special antivirus periods, and we will also make sure that these facilities that violate these guidelines will be faced with zero tolerance rules. And as for the public, we ask you to refrain from having outings and also stay at home as much as possible. And if you have any suspected symptoms of COVID-19, we ask you to get tested as soon as possible. And at businesses and private sector, we ask you to refrain from having also trips and also group meals. And we ask you to also utilize the work from home scheme in order to reduce the number of workers at the office place. And as for the multi-use facilities, you need to also ventilate your space on a regular basis and also have a strict entry log of all of the visitors. At all of the facilities like cram schools, singing rooms, pubs, and also clubs, we ask you to get the regular PCR testings. And at medical centers and pharmacies, if you have any patients with clinical symptoms of COVID-19, please encourage them to get tested as soon as possible. Moreover, during the summer season and also during the monsoon season, we are expected to spend more time indoors, and we need to also take particular precautions for ventilation when we are using the AC. Today, we are seeing our daily tally hovering around 1,275, which is the highest record daily case since the onset of the pandemic here in South Korea. For the time being, we also see a very high possibility of a continued rise in the number of new infections, and we believe that this is the beginning of the fourth wave. And I would like to apologize for the fact that we are facing such a critical moment. rate. And right now, we are also seeing the number of vaccinated people with their first dose standing at over 30%. We can protect and reduce the number of fatalities and also reduce the number of critically ill patients. However, this also is far short of the herd immunity that we can reach going further. And we believe that our lack of social distancing measures and the prolonged COVID-19 pandemic has led to such a result. And once again, I am very fortunate to have to say that we need to ask you to continue to comply with stringent COVID-19 restrictions. However, centering around the metropolitan area, once again, we need to ask you to come to a halt. Right now, if we are also seeing the continued increase as for the younger generation, and we want to thank you once again for your continued participation. However, before we roll out the vaccines for these group of people starting from August, we ask you to continue to comply with stringent quarantine measures. We need to tighten the rein right now, and we need to also minimize the losses and financial damages on our economy as well. And we believe that united efforts and solidarity of coming to a cease and coming to a halt right now temporarily, it is very effective to contain the virus going further. And we ask you to also get tested as soon as possible if you have any clinical symptoms, and wear your face mask at all times and ventilate your space as much as possible. And with these concerted efforts, we are very confident that we can contain the virus going forward. And we believe that this can only be overcome by the cooperation between the public, the private sector, and the government. And the government will also exert our full efforts to this end. Thank you very much.
그럼 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, and that was Chung Young with Thursday's afternoon briefing, and I have Soa here in the studio with me to tell me more about what was shared.
Yes, well, since we have been marking the highest daily number of infections this Thursday, Chung stressed that the situation is serious, and also that there is a high possibility that infections in the coming days will rise even further. So she said we cannot rule out that the Delta variant could become the dominant strain here in Korea. In fact, in the past week, the increased rate of COVID-19 infections, she said, surged by 53% compared to 3 weeks ago. But one positive development is that compared to back then, the fatality rate now is at around 1/3 of before the vaccination campaign started here in the country. So the KDCH chief called on the following for the nation's people to abide by: cancel all gatherings if possible. Also, if you have any even lightest symptoms, get tested for the virus, delay any business trips or meetings if possible, and also refrain from after work meals and try to work from home if that's possible too.
I see. All right, so as always, thank you very much for that.
My pleasure.
News of breakthrough infections have been making headlines in recent days as countries with remarkable vaccination numbers, including Israel, report of coronavirus infections among those who have been fully inoculated. For more on this reality, I have Dr. Katharina Song from the International Vaccine Institute. Welcome back, Dr. Song.
Thank you for having me.
And I also have Professor Sarah Ok Shin from Korea University. Good to see you again, Professor Shin.
Thank you for having me.
Meanwhile, joining the session virtually is Professor Monica Gandhi at the University of California, San Francisco. Pleasure to have you with us again, Professor Gandhi.
Thank you.
Professor Shin, we'll start here in the studio. Out of more than 5.4 million people who have been fully vaccinated here in the country, 81 have been infected with COVID-19 as of early this week. What are your thoughts on the rate of breakthrough infections here in the country and on the need to closely monitor these cases?
Yeah, first of all, let me give you some numbers. So of those total 81 breakthrough infections, we had 37 people they were given Pfizer vaccines, followed by 25 with AstraZeneca and 19 with Janssen vaccines. So the type of vaccines didn't really matter in terms of causing these breakthrough infections. And as you say, these cases were extremely rare, considering that we have over 5 million people, which are about 10% of our population, being fully vaccinated. And in most cases, these breakthrough infections were, very mild. But nevertheless, these breakthrough infections will continue to increase as more people will get fully vaccinated in our country in upcoming months. And we also have to keep in mind that although the current COVID vaccines are highly effective, they are not as effective against the Delta variants, and which means that the risk of getting COVID infections after vaccination is never going to be zero. So that's why we still have to be cautious, and we have to recommend vaccinated people getting precautious, reasonable precautions, they need to still wear the facial mask in crowded places and still take the social distancing measures.
Even after inoculation.
Right.
Professor Gandhi, what can you tell us about breakthrough infections over in the US?
It's exactly the same phenomenon, that it's very rare to be severe. So out of 154 million Americans vaccinated, the CDC is tracking only severe breakthrough infections in a standardized way, and 0.002% of them actually required hospitalization, which is a very low number. And then in terms of those who have died from COVID after getting inoculated, the rate is 4 in 1 million. So many zeros before the 0.0004%. So it is very rare. It is to be expected. No vaccine is 100%. But most of the breakthrough infections that we're seeing here, even with the Delta variant, among vaccinated people, are mild infections. And then many of them are actually asymptomatic because we're still doing some testing of asymptomatic people after vaccination without checking the test characteristics, like cycle threshold of the PCR assay.
Right. Professor Gandhi, you mentioned this, but as of the start of May, the US authorities stopped counting all breakthrough infections, and they're focusing, like you said, simply on cases that involve hospitalizations and fatalities. What is the rationale behind this move, and what are your personal thoughts on the matter?
I don't think we should be checking or tracking asymptomatic breakthroughs. So I agree with them there, because asymptomatic breakthroughs after vaccination, because our PCR tests are so sensitive, could literally be representing dead virus in the nose, because we don't incorporate often this cycle threshold of the test, which means you have to go through cycle after cycle after cycle. And when you get to a high cycle, that means there's a very low viral load in the nose. And an asymptomatic breakthrough is really a vaccine success, and unless you calculated the cycle threshold. However, I likely would have calculated by the CDC symptomatic breakthroughs, even more mild symptoms than requiring hospitalization. That would have been my thought that the CDC would have done. I think their rationale for tracking severe cases is that every state, we're like 50 different countries in the United States, are doing many different things in terms of testing. We don't have standardized testing protocols. One state will do a lot of testing, one state will do less. And so I think it was just easier for them to track that information.
I see. Meanwhile, Dr. Song, I've been told breakthrough infections are rare, but they're not unusual. Could you tell us a bit about why or how they occur?
So COVID-19 vaccines are effective and are a critical tool to bring down the pandemic under control. However, no vaccine is 100% effective at preventing illness in vaccinated people. There will be a small percentage of fully vaccinated people who will get sick, hospitalized, or even die after with the COVID infection. For us to understand the reason behind the breakthrough infection, as authorized COVID-19 vaccines are administered more broadly in the world, it will be important to monitor breakthrough cases to identify unexpected trends or clustering in the patients. So we need to know differences in individuals, underlying medical conditions, locations of infection, and we need to also look at what vaccines were administered, how the dosings were, what were the lots, what was the storage conditions, was it the right temperature, etc. So there is mixed evidence regarding whether these variant strains are less susceptible to vaccine-induced immunity. However, it will be important to detect virus breakthrough cases that may result from a shift in the susceptibility of circulating viral strains.
I see. And Professor Shin, we've touched upon this particular fact a few times before. So you've said viruses mutate, so the birth of variants is inevitable. Now, having said that, what impact does this reality look to have on the rate of breakthrough infections?
Yeah, so there's no doubt that this, Delta variants are becoming really the dominant species, and that's because, Delta variants have this nature of being highly transmissible and causing these asymptomatic or mild symptoms. So this could be one of the reasons why we are getting more breakthrough infections in our country and around the globe. And if you look at the situation in Israel, Israel is like one of the most effective vaccination drives, right? Because they have like 60% or more population being fully vaccinated. But just last month they just started seeing more Delta variants emerging, and now 55% of new infections in Israel are breakthrough cases. And the recent study says that the Pfizer vaccine that Israel have used provided only 64% protection against the Delta infection. So I think it is definitely necessary for us to start thinking about, carefully on these stepwise plans on the booster shots in our country in the near future.
Right. Dr. Song, I believe you touched upon this very briefly earlier, but are the chances of breakthrough infections perhaps affected by the type of vaccine administered?
So a lot of factors can influence on breakthrough infections. Vaccine type may be one of it, as well as vaccine dosing, storage conditions, etc. I think it would be maybe too early to say which vaccine is more superior to others in preventing variants, as there are many other factors that we need to consider as well. So we will have to look into the breakthrough cases to better understand the reason behind these cases. But what we know for sure that for now is that the vaccines are still effective in preventing the variant types.
Right. Professor Gandhi, I believe a CDC study back in June showed breakthrough infections, like you mentioned, are linked to milder COVID-19 symptoms as compared to cases among unvaccinated people. Could you tell us a bit more about this?
Yes. So, right now, the Delta variant, as in many places in the world, is the dominant strain in the United States. And what we're seeing, because we really have 50 different countries comprising the country with these 50 states, is that in places with low rates of vaccination and low rates of natural immunity, which is right now specifically Arkansas, Missouri, and to a certain extent Nevada and Utah, are seeing increased cases and increased hospitalizations. The hospitalizations aspect really has to do with the fact that severe disease is occurring in those who are unvaccinated. The vaccines are remarkably effective in preventing severe disease. And so the vaccinated people who are getting breakthrough infections, again, are more mild or asymptomatic. And this is really why, when we talk about what's happening in Israel, it is important to comment that a lot of the people, their hospitalization and death rates are staying very low. They've actually had no deaths for the last 14 days in Israel, despite this increase in cases, because of this high rate of vaccination and because of breakthroughs among the vaccinated being generally mild.
Right, which again is why vaccination is very important. Professor Shin, some are calling for booster shots to boost protection against variants and breakthrough infections. What are your thoughts on this?
Yeah, knowing that the current vaccines are not very protective against the Delta variants, I think we need to carefully examine having this booster shot as a plan. And first of all, in our country, if the breakthrough infections happen, we have to find out the exact cause of these breakthrough infections and identify whether this is due to the virus or Delta virus, or is it due to the weakened immune system or the short duration of antibodies. So we have to do intense, next generation sequencing to find out whether this is Delta variants causing the breakthrough infections. Also, it takes time and effort to really prepare for the development of upgraded vaccines in response to variant virus. So we know that US and UK and some other countries are already preparing and with developing with this upgraded version of vaccines. So, they are doing, additional clinical studies. So we should take lessons from here and try to get hold of new, these upgraded version of vaccines as soon as we can.
Right. And Professor Gandhi, what appears to be the stance of US authorities with regard to booster shots? And again, what are your personal thoughts?
The one thing I want to say about the data that you just gave, Dr. Shim, about the 64% effectiveness of the Pfizer vaccine after the second dose against symptomatic disease in Israel, is that was a very small database. It was about 300 people in that relatively small database. At least in the Public Health England data, which is much larger, the 2 doses of Pfizer vaccine seem to be 88% effective against symptomatic COVID and then 96% effective against severe disease. And then there's just data published from Canada today showing the same findings as in the UK. So I'm hopeful that there's sort of an artifact about the smaller database in Israel, and we need a little more data from Israel before we get too worried about that level of effectiveness against the Delta. In terms of boosters, however, the US government is not automatically putting in boosters. They are doing 2 things. One is that they're studying boosters in immunocompromised elderly populations and people living with HIV. Actually, we're doing one of those studies, but multiple studies going on at the NIH to see when a booster should be applied. The only population right now that automatically is qualifying for boosters are organ transplant patients because of a study in the US that showed that they really needed that 3rd dose. I think it's a great point that boosters are being created that are more specific against the variants if needed. And in the meantime, right, the US government, which I actually agree with, is still first studying it before automatically applying it.
Right. Dr. Song, how do you respond to talk about the need for an mRNA booster shot for those who receive the Janssen vaccine?
So for now, there seems to be no outstanding evidence that indicates the need of booster shots for those who have already vaccinated with Janssen vaccine. And until now, no national regulatory bodies have made recommendation on this combination. So the vaccine schedule will evolve as the vaccination rate increase, and more flexibility will be allowed in future with the increase of the data. Nevertheless, we also need to think about what strategy we would be the best for the world to overcome this pandemic situation. Even in Korea, nowadays there are a lot of young people who are waiting for the vaccination, and the vaccine that we have, that vaccine that we can offer to them is limited. So we have to think about which would bring more benefit to the individuals, whether through vaccinate wider population or use the vaccine for a booster shot.
Right, and while that debate is going on, Professor Shin, what more can perhaps vaccinated people do to better prevent themselves from breakthrough infections?
Yeah, I just want to mention that about Dr. Gandhi's comments. Thank you, Dr. Gandhi, for commenting on the Israel small data. Yeah, I have seen the Canada having highly effective, high effectiveness of these vaccines against the Delta variant. Yeah. So I saw that data yesterday, and I forgot to mention it before, but thank you, Dr. Gandhi.
It's more heartening.
Right.
It's more heartening for us.
Right. So at this moment, we cannot avoid, Delta variants being more, dominant species, and there will be more variants coming up in the future, I'm sure. And I'm afraid that we'll see more cases of breakthrough infections as more people will get vaccinations in upcoming months. So as I mentioned before, we need to really invest more money and efforts to have secure booster shot plans. And we are currently in the fourth waves of epidemic, and I think it is very important for us to actively abide by these social distancing rules and wear facial masks as much as we can.
Right. And Professor Gandhi, is it necessary to call for social distancing among vaccinated people given the risk of breakthrough infections and the Delta variant?
The CDC here in the US has not reinstated face masks for vaccinated groups. In fact, in our hospital, just today, we released masking, except we're in patient care areas, but if we're around each other, we're all fully vaccinated, we are not masking as of today. And the reason I agree with that is that the Delta variant itself hasn't seemed to be, again, showing severe disease in vaccinated, and it's really the unvaccinated that are most at risk. And it's important to say that unvaccinated people are required, or at least as much as they can be, to mask in this country. And when the World Health Organization said almost 2 weeks ago now that vaccinated people, because of the Delta variant, should mask indoors, they are sort of representing the entire world, especially places that have very low rates of vaccination. We are in a lucky place in the United States, at least in many of our states, including here in California where I live. We have about an 84% first vaccination rate among adults. We've had a very rapid rollout. So there are places that are it doesn't make sense that you necessarily need to mask because our rates are still staying very low. But in Missouri and in places where the transmission is high, vaccinated people masking indoors, I think, is important. And so I think what the CDC is likely to do is say, okay, there's low rates of transmission, and then there's moderate, and then there's substantial and high. And probably they'll put into place masking guidelines for those who are vaccinated in areas of substantial or high transmission.
Right. Now, keeping in mind what Professor Gandhi has just said, Dr. Song, let's end with a few words on the importance of COVID-19 vaccination amid the spread of variants and despite news of breakthrough infections.
So no vaccine is perfect, but nevertheless, if we get COVID infection after vaccination, as Dr. Gandhi said, that your symptoms might be lessened, but and also decrease the chance of hospitalization and death. So for now, for us, increasing vaccination rate will be the most effective way to decrease the chance of having another fatal variant type.
Right, so vaccination is our best alternative right now. All right, Dr. Song, as always, thank you very much for your thoughts. Professor Shin, thank you very much for your insight. And Professor Gandhi over the US, thank you very much for your thoughts and your time.
Thank you.
Right now, do remember tougher measures are in place here in the Greater Seoul area against businesses that fail to abide by COVID-19 prevention efforts. Do take care and thank you for watching.